All right, my name is Philip Melo, and today we will talk about quite important subject: how to predict the risk of hospitalization. That is this question is quite important in the area of hospitals, clinics, and of any healthcare provider, because we would like to know when this person, what would happen with this person, let's say tomorrow, the day after tomorrow, and so forth, given their conditions of today. And today I'm going to share with you a quite valuable method, quite simple and valuable method that we can do prediction. So first of all, we just describe a patient in terms of three conditions. The first one is mild, second is moderate, and the third one is severe. So this is three categories. And evaluating the risk of hospitalization depends on, of course, various factors. Medical history, current symptoms, underlying conditions, and various things, and new tests. And we will just see what fall under each category: mild, moderate, and severe. So when we talk about mild risks of hospitalization, is that this person condition is such that he or she can be managed at home. For instance, the patient has minor cough, mild fever, a slight fatigue. For instance, as I say, that examples of this mild risk they include symptoms like fever, not high, cough, sore throat, fatigue, no difficulty breathing, normal oxygen levels greater than 95%. And the patient can eat, drink, and care for themselves. So this is a mild, and there is very slight need to keep this person in the hospital. He can be released to the comfort of his or her home. Now, moderate conditions, a moderate risk, symptoms interfere with daily activities. So a person cannot work because he has or she has high fever, persistent cough, difficulty eating, drinking. In terms of, let's say, respiratory conditions, let's say pneumonia symptom, this person has persistent cough, chest discomfort, oxygen saturation below 94, but above 90%. Mild difficulty breathing, but not severe respiratory distress. Then it is, of course, the problem with this elderly, immunocompromised, chronic diseases like diabetes, heart disease. We also take this into account when we estimate, let's say, person is moderate or mild risk. So this moderate risk has to be evaluated further with further tests and so forth. And sometimes moderate person can be stay in hospital. Yeah. Now, severe conditions are completely different, and that, for instance, the person has signs of respiratory distress, confusion, persistent chest pain, or inability to stay hydrated, and this requires immediate medical attentions together with other symptoms. For instance, this person has oxygen saturation below 90%, has severe difficulty breathing, rapid, shallow breath. Then we have, let's say, the appearance of this patient also is kind of warrants attention. For instance, he or she has bluish lips or face, organ dysfunction, for instance, kidney, liver, heart failure, sepsis, low blood pressure, confusion, organ failure, symptoms that correspond, let's say, to stroke or heart attack and so forth. Now, we should, of course, pay great attention to this condition, to severe risk. And of course, the tool to predict this, it will be very, very valuable. And I will just explain to you how in nursing informatics we do these things. So what we do first, let us just put in graphics what I would like to talk a little bit later. We will just say that this light ball, it is mild, gray, moderate, and dark is severe. All right, let's do like that. And imagine that a nurse or a doctor or any healthcare provider keeps a history of this patient in terms of these categories of mild, moderate, and severe. And the person, as you see here, was hospitalized, and 2 days he had these conditions that we attribute to severe risk. And then it goes to day number 3. It is moderate, that for, again, it was deterioration in the patient condition. Then 5 was improvement, but this moderate risk. But 6, 7, 8, 3 days in a row, it was mild, and maybe the doctor was thinking of just releasing this person. And then day 9, it was deterioration again, and 10 was again a severe risk of hospitalization. And this day corresponds to our notation as a severe risk. What has happened is that at 11th day, it was mild risk, 12 mild, 13 was moderate, and 14 again mild. So the problem is to estimate what is the severity risk at day 15. Should this patient stay in hospital, or he or she can be released, or under some condition he can be released or she can be released, and so forth. So this is healthcare provider will decide. But in the nursing informatics, we will be interested to know what will be day 15, how we can categorize this person as at mild, moderate, or severe risks. Okay, let's do this. Let's do this prediction. Okay, so first of all, we would like to look at the day 14. So this is quite important, and I will just use this pen here. So this is day 14. And as you see, day 14 is of paramount importance because we will just build this algorithm and build our solution based on the Markov field. And in Markov field and Markov chain, it is important to see what the last element of the sequence can be characterized. In this case, we have mild risk, day 14. So let us just put this as a vector 1, 0, 1, 0, 0. Now, what happens that in this method, we need to calculate the transition that corresponds to this initial vector 1, 0, 0. So first of all, this we have to do the thing that we need to see how many transitions were at mild to mild. This is 1, mild to mild. Let's see, mild, we have this 6 to 7. This is number 1. Okay, this is one transition from mild to mild. Okay, then we have from 7 to 8, another transition, mild to mild. So it's another transition. And 11 to 12, it's also transition. So we can put here a number 3. That's it. So we calculated that we have 3 transitions that correspond to the last day, which is mild risk. So we can put here 3. Then we have here the, we need to calculate the transitions from mild to moderate. Mild to moderate. Let's see now. Mild to moderate is this one. Mild to moderate is this one. Mild to moderate. I have one from day 8 to day 9. Mild to moderate. And mild to moderate from 12 to 13. Okay, let's check once more. Yes, here is nothing. And from 8 to 9, it is from mild to moderate. And 12 to 13, it is also mild from moderate. So we have two transitions, this one. Now, I think that I already tried to underline this one. We do not, it isn't confusing to give a solution like that. We always put in percentage. So we need to sum up the elements of the transition vector. 3 plus 2 is 5, this one. 3 plus 2 equals 5. And this corresponds to 100%. Always the sum of the transition vector elements is 100%. So what does it mean 1? If 500, 1 is 20, right? So 3 corresponds to 60%, and 2 corresponds to 40%. But what does it mean 3? 3 transitions from mild to mild. So the patient has 60% is the probability that this person tomorrow will have this favorable mild risk, okay? But there is 40% that it will be deterioration tomorrow, but not too severe condition because there is 0 here. 0 here means we do not have probability that tomorrow this person will develop severe conditions, severe risk, like, for example, day 1, 2, 4, and 10. So sometimes in hospital, mild and moderate are considered as favorable. So in this case, this person has 60% of mild risk tomorrow, and 40% is a moderate. So this person has altogether favorable conditions that doctor then should decide what would happen with this. More likely, he can be maybe released or she can be maybe released and to the comfort of the patient home. But it is up to the nurse and healthcare provider. They will decide it. But in terms of informaticians, we say that day 15, this person has favorable condition because 60% is mild and only 40% is moderate and no severe. Let us see what happens next. And next situation, we have day 14 now is moderate. So let us see now estimate what happens in this situation. So this is this one, 14. Now it is moderate. And this is quite important because you know that in our algorithm, first we examine the last day of the sequence, and then we will predict what happened next day, right? So that is what how we work. So in this case, our vector that corresponds to this ball, last ball, can be examined as 0, 1. So this is a mild, moderate, and severe. So this is 1 corresponds to this last day, 0, 1, 0. Now, what happens is that we calculate the transition vector. So first we have to calculate the transitions from moderate to mild, because this is the transition vector corresponds to moderate. So moderate to mild transition. From let's say from moderate to mild, we have how many? We have only 1 from day 5 to day 6. because this from moderate goes to severe, and there is from moderate goes to moderate. So we have only one transition. What about moderate to moderate, which corresponds to 1 at the initial state? So initial state means day 14. So we have how many? We have only 1, 13, 14, 1. And now this one corresponds to moderate to severe. How many we have? From moderate to severe, we have day 3 to day 4, it's 1. And from 9 to 10, this also from moderate to severe. So we have 2 transitions, right? So now the transition vector is now 1, 1, 2. In our previous example, it was 0 here. So we had only 2 options. Now we have 3 options. It can be mild, can be moderate, or can be severe. Let us calculate the percentage-wise, also very simple. So as I told you that this one is always 100%, we need to sum up the elements. Will be 1 plus 1 plus 2 will be 4. This corresponds to 100%, and 1 corresponds to 25 now. 1 corresponds to 25%. So 2 corresponds to 50%. And we come to the conclusion that the severe risk after day 14 is quite high. It is 50%. And 25% it is mild, and 25% is moderate. So it is like 50-50 now. So it can be also that day 15 can be quite detrimental, can be worsen, situation of the patient. And therefore, of course, doctors should also take this into consideration, because 50% is 50-50. Okay, in our previous example, it was, let's say, 100% was favorable condition. In this situation is 50-50. Okay, so probably additional evaluation is important. Let's go to third one. In third one, we have situation like that. We have now 14, and we just put this initial condition as 0, 0, 1. This corresponds to transitions to severe to mild, this severe to moderate, and this is severe to severe. Let's do this. So severe to moderate, this one, it is how many we have? Severe to moderate. So we have severe to moderate, or severe to mild. We will start with this one. This is severe to mild. Severe to mild, we have day 10 to day 11. This is severe to mild. This is first element. It is only one transition. Now, severe to moderate. Severe to moderate, we have severe to moderate 1, severe to moderate 2, and that's it. We have 2. And then severe to severe, we have only 1. From day 1 to day 2, when he was hospitalized, we know that from day 1 to day 2, he was in a severe risk of hospitalization. He was hospitalized. So that is only 1. Now we do usual procedure. We just sum up the elements of this transition vector, which is 1 plus 2 plus 1 is 4. This corresponds to 100. 1 corresponds to 25. And 2 corresponds to 50, right? 2 times 25 is 50. So let us see now. So we have this 25% that he will be at mild risk. 50% he will be in moderate risk, and 25% he will be in severe risk evaluation. So if we say that we take mild and moderate as a favorable, we have 75% of favorable. And this is better than it was previous example. Although day 14 we had a moderate condition. Now we have a high risk, severe. But in overall, that the probability of staying 14 is only 25%, and 75% is this patient will be in favorable condition, will be mild or moderate. Okay, so that is how we work in nursing informatics, a very simple method to evaluate the patient condition, patient categories of risks based on historic recording of that. Okay, I just described this in terms of three categories, can be four, can be five. It's up to the disease, up to the hospital. But this is a method, it's a universal method that can be used, and it is quite accurate and quite valuable for nursing informatics to evaluate the patients in who is hospitalized or who can be stay in hospital, can be released. All right, so thank you very much for your attention. Bye-bye.